કૂદીને પોતે પધારે છે અને હુસૈનના સાથે બી ઇમામ હુસૈનના સાથે શોહદામાં દેખીએ કિતના મોટા મોટા શોહદા કિતની ઉંમર અલગ અલગ તો they all showed physical feats that could only be possible in at an extreme age if they have physical fitness, right? And so today our topic na upar inshallah zikro thase. Now does that mean ke asagla uliyaullah exercise karta tha, warzish karta tha? Kem khabar pade bhai? To આજના જમાનાના દુઆતોનો અમલ દેખીએ એના અંદર ખબર પડશે આપણે કે કઈ શાકિલતથી ફિઝિકલ ફિટનેસ કરતા હતા અને થતા હતા. I killed it. Did I kill it? I may have killed it. Oh, there we go. Okay. So, the teachings and practices of Duat Mutlaqeen give us some insight into how Awliyaullah and Sagla Ashab che, what they believed about physical fitness. So, I'm going to just share two stories, Duat Mutlaqeen Masi. The first one I want to share is Sayyidina Tarasifuddin Aka apna Risala Kausarul Khulna andar apiye Al-Jamiatus Sayfiya jeware banayo. When he made Al-Jamiatus Sayfiya in Surat, he talked about what his reasoning was behind all of the different buildings he built. Why he built the library, why he built the Iwan. Emasi Khaymatul Riyazat. Kitna logo, how many of you have all seen Jamia in Surat? How many of you have seen the gym area, the pool? There's a fantastic facility there. Mulai kewa shanti banayo chhe. That's called Khaymatul Riyazat. So e zikr na andar Sayyidina Tarasifuddin Aka akhi risala na andar he talks about why he built the Khaymatul Riyazat. So let me just briefly summarize what he said. Pote em farmayo risala na andar ke harakat maj barakat. Harakat maj barakat. Now, for those of you, harakat just means activity, movement, right? Action. Ema barakat. And pote em farmayu pachi ke enasi su faydo થાય છે કે પહેલે ખુદાની ઇબાદત કરવામાં યારીને તૌફીક મિલે છે અને જે આજે ભાઈ સાહેબે બી zikr કીધી કે નશાત આવે છે નશાતથી ઇખલાસ અને ઇખલાસથી નશાત એ જે હરકત જે છે એમાં બરકત છે. So how do you what are we talking about with harakat, right? તો પોતે ખૈમતુલ રિયાઝતની zikરમાં પછી ફરમાવે છે આપ કે રિયાઝતના સબબ જિસ્મના હર ઉઝુની હરકત બાકી રહે છે. So riyazat means sports, activity, fitness. પોતે એની વાત કરી રહ્યા છે. So when he said that he built the Khaymatul Riyazat in Jamia, he basically said કે એના સબબ તલબતોને નશાત આવે છે, ખુદાની ઇબાદતમાં યારી મિલે છે અને that's the purpose, right? So even for us at the age of 50 plus, મોમિનીનને સમજાવવું ઘણું જરૂરી છે કે હરકતમાં જ બરકત છે, and the only way you can do that is to practice some level of physical fitness. હવે one last zikr પર मैं तमाम करूँ છું. एक सैयदना इस्माइल बदरुद्दीन साहब, जनाब आमिर साहब, ये शुक्र साहब. एक सैयदना इस्माइल बदरुद्दीन આકાની zikr છે મુંતઝલ અખબારના અંદર. એ zikરના અંદર પોતે એમ બતાવે છે અખબારના અંદર કે at the age of 95 પોતે શું અમલ ફરમાવતા હતા હર રોજ કે સૈયદના ઇસ્માઇલ બદરુદ્દીન આકા પોતે હર રોજ નમાઝના પહેલે ગુસલ ફરમાવતા હતા. એના સાથ બી હર રોજ રાતે નિસ્ફુલ લૈલની નમાઝ અદા કરતા. હર રોજ તસાબીની નમાઝ અને બીસરાઓ નમાઝો બી આ પોતે કરતા at the age of 95, right? અને હર રોજ ફજરની નમાઝ બાદ until Zohar he would conduct sabaqs, અને અસરની નમાઝ બાદ મગરિબ તક પાછા સબકો અસબાક કરાવતા હતા. So સૈયદના ઇસ્માઇલ બદરુદ્દીનના અમલથી એમ ખબર પડે છે કે even at 95 આપ હરકત બાકી રાખે છે, હરકત બાકી રાખે છે. હવે કે આખરી એક જિકર કરી દો આપ સગલાને કે ઝોએબભાઈ સાહેબ પોતે સૈયદી હુસૈનભાઈ સાહેબ માઝુન સાહેબ આખા એના પોતા થાય ગ્રેન્ડસન થાય એ એટલે સૈયદ હુસૈનભાઈ સાહેબ એના નાનાજી થાય પોતે એમ જિકર ફરમાવતા કે પોતે કંઈ વર્ઝિશ કરતા હશે એટલે તે વખત માઝુન સાહેબ પધારા હતા અને પોતે એમ ફરમાયું આ સગલાને જોઈને they're working out, doing their physical fitness deal. પોતે એમ ફરમાયું કે હમે જે આજે ફિટ છે કે આ માઝુન સાહેબ ફરમાવે છે હમે જે આજે જે ફિટ છે આ એજમાં હમે આગળ ઘણી વર્ઝિશ કીધી છે તમે શું વર્ઝિશ કરો છો? So what he meant by that was like, you guys don't brag. તમે લોકો જે ફિટનેસ ને અમલ ને બધું કરો છો તમે લોકો કંઈ બી નથી કીધું. અમે જે કીધું છે એ હવે it has nothing compared to what you all are doing here. So માઝુન સાહેબ બી 100 વર્ષના પહોંચ્યા. અસબાબ બી એવા શાંતિ જ પર આવી રહ્યા હતા અને બુરહાનુદ્દીન મોલા અને મુફદ્દલ મોલાનું મિસાલ આપના સામે જ બુરહાનુદ્દીન આકા 100 વર્ષ તક પહોંચ્યા. So physical fitness plays a very important role in our history. આપનું દીનનો એક હિસ્સો બી છે. So I'm really looking forward to hearing all the good advice today. Thank you સગલા જે સગલા ઓર્ગેનાઇઝર્સ જે છે અને ખાસ સાહેબો જે પધારા છે આપ સગલાનો શુક્ર અદા કરીએ છીએ. And let me turn it over to Moiz to get us started on what we can do above 50.
Shukran Mansoor bhai. So the next talk will be Shazad by Carbaidwala, who actually is a former professional athlete, bodybuilder, NCAA athlete. He's also a physical trainer. He's been heavily involved in our community working with fitness and also an entrepreneur with his own nutrition program. So I'll turn that over and he's going to talk about how to get our community and our patients more involved in fitness.
Thanks, Moiz. Salams, everybody. So typically when I do these talks, I have a whole script that I follow. So let me take it out. Okay, so everyone stand up. Everyone stand up. Let's go. Everyone stand up. I see some of you guys are in this conversation. It's such an important conversation. Mola has expressed to us the importance of physical fitness, right? And some of you guys are already sleeping. Come on, let's wake up, drink some coffee. Let's go physical fitness. What does physical fitness mean to you? Right? So just a brief background, because I only have a little bit of minutes because Moiz is going to get mad at me if I take too much time. So, yes, competitive background, bodybuilder, NCAA athlete, and been personal training for the last 20 years. I have my own gym. This is the most important. Can we go to the next slide? Yeah. This is my passion right here. Us, all of us, getting more fit together. Okay, but there's a gap. There's a little bit of a gap because what's the gap is we can't define what physical fitness means to us. So you have to do some self-reflection. You have to look in the mirror and say, what does Mola said? We all should be fit, getting fit, but there's such a wide. No one knows what that really means unless you actually do that calibration in your head. And what does physically fit mean to you? Because it's something different for everybody, right? So physically fit can mean going in the gym and doing strength training, lifting all this heavy weight, something that I used to do. That doesn't mean fit for me. It's changed now. My physically fitness means being able to do stuff with my daughter, whatever she wants to do. If she wants to go swimming, I go swimming. If she wants to go in the playground, I go in the playground and play with her. I don't just watch her. So you have to find what that means to you first. The second thing is, what are the applicable resources that we have within our community to get physically fit? There's not a lot of us, right? So who are the people that could really help be the catalyst, the trailblazers for you, Mu'mineen, to get physically fit? The third thing is self-promotion. within our community. We have to make sure as physicians, medical practitioners, that you guys are going out, and when you see patients, one of the first questions you should ask them is, what are you doing for health and wellness? Don't just prescribe them some medication, right? You ask them, you do the analysis, are you keeping in shape? Are you doing anything to promote yourself to become physically fit? Okay? So, makes sense, everybody? Yeah? So, this is interactive, guys. I haven't having you stand up for a reason. Ask questions. Interrupt me. It's all good. So, this is all stuff. There's a million other things, right? But two things that are applicable to us is namaz and sitting on the ground for long periods of time. We do that, right? So, increasing chance of praying namaz without functional support. Yeah, we go into masjid, and nowadays you go in the masjid, and it's like an auditorium filled with chairs. Right? People are sitting in chairs now. Not a lot of people are sitting on the ground. And everyone makes the same excuse. Oh, well, why are you sitting on the chair? Oh, I don't want to hurt my knees. Or I've had the arthroscopic surgery right on both my knees. No, sit on the ground. You are not physically fit enough to sit on the ground. That's the excuse, right? That's what everyone should think. Yeah, it's hard. It's hard, right? Sitting on the ground for long periods of time. So a bunch of other things too. And these slides get shared, right, to everybody? Yep. We can, yeah. That's good. So some of the things for us, right, forms of wellness is namaz. Now, if you think about namaz, the act of actually going through the process. Okay, so we're doing namaz. What is this? Training our biceps, right? This. Triceps, right? When we go down, lower back and hamstrings and our backside, right? When we go all the way down, knees, right? We need all these functions, all these muscles to be firing at all cylinders when we pray namaz every single day.
One thing I'll add.
Yes.
Do it slowly.
Yeah. Oh. This is good. You're not even you're going to break your body, right? You do it 5 times a day, it's difficult, right?
You damage your knees and your ankles and your hip joints.
Yeah, that motion right there with the knees, that could tear your ACL, right? That just happens so much times. Yeah, go slow. Namaz is our spiritual thing. We want to go slow through it. But yeah, a bunch of different things. This one, guys, I'm a big self-promoter of strength training, especially when you get older. Our muscles deteriorate really quickly, especially when we get above 50. So that is an important thing. In my opinion, this is the most important. This is good, but it's not enough. Strength training is very important. What else? Okay, so this is an important slide. Recommended resource, and you can see I'm not a very big PowerPoint guy, so I apologize of the optics. But join the Anjuman Safety Fitness WhatsApp group. That was established 3 years ago. It's got 150 mu'mineen in it, both men and women across the world. There's only one person that communicates. We share coordination of our Sunday live training sessions in Chicago. It goes out to everybody. So please join this group. There's only one person that can speak. I do it to everybody. So one person can speak. I send fitness tips. And the reason why the introduction for me was so important is with my background, I was very lucky and very blessed to work with some amazing people that taught me about the true meaning of fitness. So the stuff that I'm sending to everybody, all the mu'mineen across the globe, is not based on something I went on Google and read. It's stuff that I've done myself. It works. I know it works. You have to trust in me that I'm giving you the right information. So Sunday morning virtual training sessions at 9 a.m. If you'd like to join the WhatsApp group, call me. I don't know where my contact information is, but I could share that. Also, Sunday morning yoga sessions at 9 a.m. there's 2 women that run that yoga program. You could join that as well. And then in New Jersey, there's 2 sessions as well, Tuesdays and Sundays. So, guys, the resources are there. So the excuses can't be there. Well, I don't know who's there. I'm here. So we have people that are here to help. Yes, please.
So the sessions in New Jersey, the live session is held every Sunday at 10:15 with Vayajoshan and Tasveer, which is the Kapasvi Kadiki Mandatu Sadiki. And then we have 2 therapists. One therapist does the first 40 minutes, and then I take over and do the other 40 minutes. We kind of break it up as upper body, lower body, but it doesn't happen like that. We do what we do. And this has been going on since November of 2019. So all throughout Zooms, we had Zoom sessions throughout COVID and all, and we had people from all over the world joining us. Or ab jab ke Zoom life has come back to normal, we don't have that big a group, but we still get 40, 50 people a week. And on Tuesdays and Thursdays are the recordings of previous sessions that are shown in the morning. And the reason I interjected is because I do the Sunday live sessions. So please join. We would love to have all of you there. It's a fun session. I have somebody here who has been a part of it. I didn't know her. I came to know her today when she came and said, hey, I see you every Sunday. So please join. Thank you.
Yeah, you're welcome. So the resources are there. Yes, Mike. Oh, of course.
Just as an FYI to everyone here, Shazad is running the Sunday session from here, live from the conference tomorrow morning at 7 o'clock.
7 in the morning.
7 o'clock in the morning.
It's early. But so what we're going to do...
Invite all of you to come.
Yes, everybody. Men, women, we'll get the hotel staff. Everybody will be fun. So the 3 categories of that, thank you, Bhai, for that, explaining that. We're going to do appropriate stretches before we do namaz, appropriate stretches before we sit in the towel and we sit for wise. And then the third thing is we're going to do some fun karate, mixed martial arts stuff. It'll be fun. So, looking forward to seeing everybody. Please come. We'll have a good time. So for the Sunday session, guys, these are the things that we use. So if you're asking, well, I got to go out and I got to buy all this strength training equipment, nope. You give me a water jug, fill it with pani. You give me 2 water bottles that are filled with pani. You got a broom handle. Everyone's got a broom handle. Lower it. Take out the screws. You got that. A suitcase. Everyone got luggage. You had to come here, right? So a chair and towels. Bus. That's it. You have that. Well, you got your own gym. Yeah. Good, right? Yeah. And we've been doing this for years, so it works. Testimonial. Some people said some good stuff. You know what? Someone did actually tell me something important. So there was this guy who, he raised me actually. I've known him for probably 40 years. I'm only 25 years old. But yeah, thank you. But he actually told me, he's like, I had a torn labrum and a partly torn rotator cuff in my shoulder. And he's like, I didn't believe in strength training at all. I started your strength training workout, and my shoulder problems has been alleviated. It's pretty good, right? He's been having it for years. He's done the program for a couple months, and his pain in that is gone now. So it's good. Okay. Sorry, man. Okay, save it till the end. Okay. Good? Good. Yeah, absolutely.
Shukran, Shazad Bhai. Excellent talk. And sagla beso and I think Shazad Bhai's point was कि अपने sagla इतला वासुदी उबारे अपने अगर थकान लागू होए इतला टाइम सी उबारे होने वास्ते तो इंट्रो टू जो है कि मैं खाली 10 मिनट नो talk करता हूँ ये मामले इतलू थकान लागी कुछ उबारे वासी एक सोचवानी बात है. So, anyways, my talk is going to be kind of more technical from the orthopedic surgery standpoint. As an orthopedic surgeon, we obviously deal with the patients who have, he deals with healthy people. I deal with the patients who have pathology, who have some type of issue, who have pain, who have some level of discomfort. And so we deal with what I would call the unfit joint. And so fitness over 50, fitness for the unfit joint. How do these people who have issues deal with their fitness? How do they proceed? So the unfit joint, how do I define it? I define it 4 different ways. One is a normal or abnormal joint in an unfit body, someone with abnormal body habits, low or high BMI, sedentary lifestyle. If you're not doing a lot, your joints are probably not going to be in great shape. If you have underlying systemic diseases, metabolic disorders, hormone imbalance, the joint that's injured, if someone has an injury, they sustain an ACL tear or something along those lines, that's an unfit joint. And then joints with degenerative arthritis, which oftentimes a lot of us have and a lot of us get, and almost everybody gets. And then the joint, after it's been replaced, after it's already completely declined and now an orthopedic surgeon has changed it, that's still not a normal joint. So how do you pursue fitness? So again, in the abnormal joint, in an unfit body, you're going to treat some of the underlying factors. You're going to try and normalize the BMI, address metabolic disorders, mental and medical health issues oftentimes that play a great role here. And so addressing the mental health is super important. When you have patients with an abnormal body who have a low BMI, cachexia, they oftentimes will have muscle wasting, they'll have other issues that will kind of affect how they might have weak bones, osteopenia, osteoporosis, that will affect how they function. And again, for these people, we typically are going to recommend gentle progressive fitness regimens with adequate support. We're not going to say you need to go and exercise. Take it easy, but do some level of low exercise and make that progressive, increase slowly over time. We're going to emphasize more weight-bearing exercises to build the bone mass and certainly limit overactivity and overuse, as that will oftentimes trigger things like stress reactions, stress fractures. If you have a patient with a high BMI, obesity, we had a great talk this morning on fitness for these patients. But again, to lose the weight, the drugs and everything are helpful. Most people out there typically don't want to take drugs. They don't want to take medications to lose weight. They want to figure out other ways to do it. So for these patients, higher intensity workouts are helpful. Again, you have to get the basal metabolic rate up in order to burn the calories, but you want to do it in a low impact fashion. So you don't want them running or jumping, things, a lot of these HIIT, high intensity training and other hardcore classes that are out there. I'm trying to blank on the name right now. But these will be good cardiovascular regimens. Walking, progress to a little bit of jogging, the elliptical machine, biking, swimming, rowing, Stairmaster. These are all low-impact activities. And support, again, with good footwear and so forth. Now, here's the issue with obesity and people with high BMI. It's a catch-22. People say, well, my knees hurt because of the increased weight and lack of exercise. But I can't lose weight, and I avoid exercise because my knees hurt. So what do? You have to break the cycle. How do you break the cycle? NSAIDs, anti-inflammatory medications, braces, supplements, injections, placebo. I don't care. Use everything, Whatever works. You try this, you try this, you try this. Anything that's going to get people to try and believe that they're losing weight, believe that they're feeling better, that'll help them kind of continue to fight through some of the pain to be able to do the exercise, pursue the fitness, and lose their weight. Oftentimes, people who are losing weight, they find that their pain gets worse. And it does, because the stresses across the joint will change. However, you have to tell them, keep on working through it. The pain will eventually come back down again. A lot of patients come and say, Doc, fix my knees, give me knee replacements, and then I'll lose the weight. Knee replacements do not lead to weight loss. That's been well studied and well shown. You get new knees, and first of all, you can't even get new knees unless you meet certain criteria. Your BMI has to be below 40. You have to be medically optimized. Diabetes has to be under control. If it's not, you're going to basically have higher risk of complications with a knee replacement. Again, people get new knees, and they just get to the fridge faster. So that's not the way to lose weight. Fitness specialists, trainers, nutritionists, dietitians, mental health support, bariatrics, those are many different tools that are involved in the weight loss process. Again, you have an injured joint, talk to your orthopedic surgeon. He'll tell you how to do the fitness based on what the pathology is. So again, the degenerative joint, how it occurs, the mechanical factors, injury, sports, activity, high impact activity, environmental factors, and hereditary family history as well has a role to play there. Again, Shazad talked about the benefits of fitness. They're vast. The question is asked, okay, so you just told me in the previous slide that activity worsens arthritis, or activity is one of the risks of arthritis and so forth. But the reality is it's dose dependent. If overactivity, overuse, heavy use is the cause of injury versus use in moderation is actually beneficial. There was a 20-year natural history study where they showed that runners who are running in moderation had a 10-year decrease in their disability level compared to the person who's rather sedentary. And again, there's other studies that have shown no risk of increased OA in exercise. So again, the benefits far outweigh the risks, and ultimately we can mitigate the risk with certain types of exercises. In addition to that, the exercise benefit your heart, lungs, and brain and take some toll on the joints. We can replace the joints. We can't replace the heart, lungs, and brain. So again, if there is a risk-benefit analysis, if you want to err in the favor of being active and having an active lifestyle rather than being sedentary, despite whatever potential risk to the joint you have. So again, fitness exercises that mitigate the risk, cardiovascular stuff, again, low-impact activities, swimming, biking, fixed platform exercises where there's no impact across the joints. Joint protective exercises will combat muscle inhibition from the arthritis. Arthritis inhibits the muscles. You build those muscles up. That's going to actually decrease your pain. And again, weights and resistance are the way to do that. Strengthen your quads, glutes, and core muscles. Stretch out the tendons and so forth. Again, it doesn't matter where the arthritis is. So again, if you have arthritis in the anterior knee, the patellofemoral joint, you're going to have slightly different types of exercises versus if you have it in an axial load-bearing joint where the impact is transmitted right straight through the joint. So again, tibiofemoral, hip OA, you're going to do more squats, wall squats, leg press, clamshells, and avoid extensive running, jumping, high-impact stuff versus patellofemoral arthritis where it's really deep knee bends that tend to cause more of an issue, Stairmaster, where there's a lot of tension across the quad and the patellofemoral joint. Tricompartmental arthritis is a combination. So again, the final category that I talked about was after you had your knee replaced, then what type of exercise and fitness can I do? This is important. Why does it matter? Because now you have an interface between metal, cement, and bone. And that's not a normal one bone altogether. It's basically components where there can be dislodgement, loosening, there can be wear, And so, again, overuse different types of exercises can result in failure of an arthroplasty. There's stress risers where you have a solid, rigid metal implant against a softer bone where, again, if you have an injury, you may be more prone to what we'll call a paraprosthetic fracture there. There's a liner, a little piece of plastic right in between the, I don't know if I can show this, still bounce off there, between the metal components. This liner is oftentimes where you'll see wear after an arthroplasty with overuse, and there's two types. One, it can crack and fail suddenly, catastrophic failure, or it can slowly degenerate with attrition, and oftentimes that will result in a failure. So for these patients, what type of exercises can they do? Avoid high-impact activity, of course, because again, we talked about potential for loosening and failure from that standpoint, and avoid high-risk activity. So again, typically for a regimen after total knee arthroplasty, it's progressive, walking, stair climbing, swimming in the beginning, and then eventually as time goes by after your replacement, when you get to the 6-month mark, you can do tennis doubles, you can do rowing, you can do dancing, table tennis, skiing, ice skating, and certainly hiking. But again, we typically will always avoid running, jogging, basketball, soccer, baseball, some of these, again, martial arts, high impact, high stress activities that are going to potentially risk the implant and the joint. Some people do them, and some people get away with them, but at the same time, we typically, as orthopedic surgeons, are not going to recommend that. So I got a couple patients that we can just go through, patients that I've seen. So this is a 27-year-old male with bilateral hip pain, started about 6 years ago from a basketball injury, and he presented with severe stabbing, sharp throbbing pain. You can see his medical history is not too significant. He does have a significant left hip loss of range of motion and what we call impingement signs and some problems with his gait, some myalgia there. So this is his images. And again, you can see on these images, he's got pretty significant destruction of both his hips. Normally, this is a nice round ball that you see over here, but he's got collapse and sclerosis. He's got osteophytes present. So this is a hip in a very young patient, which is fairly destroyed. So the diagnosis here is bilateral hip AVN, and this occurred due to avascular necrosis or bone death. And again, this is an advanced stage, ficus stage 4. So we have a couple of different treatment options. I'm going to pick on my colleague, Dr. Mubtagil Gumbera. What would you do with this guy?
This is a challenging, very young
So exactly, yeah. I mean, you have a few different options in terms of how to treat him. Again, a lot of people argue he needs a hip replacement. Replace his hips, and then he can move on with life. But he's very young, and so again, we actually for this patient tried hip injections and physical therapy to try and delay a hip replacement at some point. Yeah. What's that? Good luck. So, anyways, what do we recommend for fitness for him? Again, given that he has a significant degenerative joint, low impact activity, a lot of strengthening, elliptical swimming, biking. What happened to him? He comes back to me 3 years later after his hip injections. He's doing great. Now some mild increase of his hip pain. He's playing basketball every weekend on this destroyed joint. And so the reality is a lot of it, he wants to do it, he's going to keep on doing it. And so what do we do with him at this point? Same thing over again. Get some more injections, do more therapy, and basically do whatever you want because these hips are going to get replaced and you might as well use them in the meantime because you won't be doing the basketball after. Patient number 2. So this patient, he was having left hip groin pain when he presented to us. 4 to 5 weeks prior, he felt a crack in his hip when he sat down. He's medical history significant for Keppra, which is an anti-seizure medication, as he had a history of seizures. Significant disability and dysfunction in his hip. When you look at his x-rays, you actually see that this patient has a left femoral neck fracture that's completely displaced. Again, a young guy, no injury, no trauma. So you're thinking, what's going on here? It's a pathologic fracture displacing a young person 5 weeks out. Main thing that we're thinking here is there's got to be some underlying condition, some other abnormal body that's creating this. You do a tumor workup, that turned out negative. It's really his seizure medication, the Keppra, that caused some level of vitamin D metabolism issue and led to some underlying bone weakness. And so again, we treat the underlying condition and we talk about what we're going to do. Try to repair the hip or do a total hip replacement. And in this case, given he was 5 weeks out, we replaced his hip with a anterior hip replacement. So again, his fitness recommendations are going to be the same for both the unfit body. He can't go back and start running and exercising. He's got to take a very slow program because he's got to get that bone density up to protect him from having other fractures and other issues, but also the restrictions for arthroplasty, which are going to be avoid high impact and generally significant issues. The final patient of mine is a Muminbhai who came to me with bilateral long-standing knee pain. He's 61. He indicated that he really does not want any kind of intervention that's going to prevent him from sitting on the ground to pray namaz in majlis. Generally active otherwise. Significant varus deformities of his knee, significant arthritic pain throughout. And you can see on his x-rays here that he has severe tricompartmental, but mostly medial, bone-on-bone arthritis, end-stage arthritis. And so for this patient, with this severe arthritis, the options are anti-inflammatories, bracing, injections, and total knee arthroplasty. But again, if he gets a total knee, sometimes it is harder to sit on the floor. He actually asked me about stem cells, and what fitness recommendations he can have, and should he continue sitting on the floor rather than a chair. And I told him actually, stem cells are probably not too valuable here. He did them anyways. I told him, fitness-wise, there might be some benefit on occasion sitting on a chair, but try and sit on the ground for the most part. And he did. He continued to sit on the ground. He came back 9 years later, still sitting on the ground, still doing well, minimal pain, and he's very happy at this time. He does have some increase in his pain, and he is considering a knee replacement at this point. But again, given that he's been able to sit on the ground and kind of pursue that for such a long time, I think that's to his benefit. So just really quickly, should we sit? I ask all the time. Patients ask, should I sit on the ground? Should I sit in the chair? What should I do? What does the literature say? So again, I did look this up and see, is there any studies on this regard? So the reality is it says use it or lose it. If you do sit on the ground, they've been shown that actually two things. One is that there's no increased risk of arthritis as a result of that. When comparing to other populations, there may be some benefit from the stretch of the soft tissues as you have that increased range of motion. Number two, the range of motion of arthritic Arab patients is the same as healthy patients versus patients who are non-Arabic, who have arthritis, who have much worse range of motion. So we're actually protecting our motion by doing this and potentially allowing ourselves to sit on the ground for longer periods of time and have better function of our knees even after arthroplasty. Additionally, there's data out there that, again, Muslim prayer does not have a negative effect on the arthritis. And then finally, just in terms of prayer in general, there's actual data out there which supports that this actually results in better pain control, better coping mechanisms for pain, and active prayer actually has better outcomes for patients as well in terms of procedures and so on and so forth. So again, ability to sit on the floor post-operatively correlated with the ability to sit on the floor preoperatively when you have an arthroplasty. So that's something that you can certainly remind people in that regard. So in conclusion, don't be this guy. He's got his remote control. The most activity he's going to do is move the remote control back and forth. And in case that becomes too much, he's got a massage gun conveniently situated nearby as well. Thank you to Sheikh Dr. Adnan Danish for unwillingly contributing. So the next talk is going to be, sorry for the...
Stem cells, what do they do?
So stem cells are basically meant as early progenitor cells. They have the ability, they are considered multipotent or pluripotent, and they have the ability to convert themselves into any other type of cell. So the reality is when you have some damage to the body is always trying to heal that damage by creating new cells to replace the damaged cells. In this case, with arthritis, cartilage, or bone that's damaged, you want to try to regenerate that cartilage. So by putting in very, very early progenitor cells that haven't yet differentiated or changed into other types of cells, those cells are still young enough that they can grow into potentially cartilage cells versus other cells that have already gone through that process are unable to do that. And so stem cells is an area where there's a lot of research going on. There's a lot of different treatments that are out there, but the evidence and the studies don't fully support it yet. But I think that's where there's going to be essentially probably the future of medicine, because if we can take younger cells and then regrow some of our organs by guiding them towards becoming cells related to that tissue type, we can potentially have improvement in our health. Yeah. So right now we don't have, the bone is actually not so much the issue, it's more the cartilage with the arthritis, and cartilage cells do not have a great capacity to regenerate. And so right now we're still working on trying to tailor those cells to be able to have the appropriate type of signaling to guide them to that type of level of regeneration. We have on occasion achieved that, but it's not something which is reliable or consistent. And so it's not something that we typically have in a standard treatment regimen. And it's very expensive.
Is it the patient's own cells?
Yes. So there's different ways of doing it. In this case, it's adipose stem cells. So again, if someone with stage 4 severe arthritis, I'm not typically going to tell them to do stem cells because it's very expensive and the likelihood of success is fairly low. But, honestly, this was probably more mind over matter. He believed in it. He did it. And him yakin hato ke maru thai jase inshallah ne mane image amal karu che to mona endwasi tej ge. So
normally generally happens after 50 only.
Arthritis? No, yeah.
Over 50, so why 50 is the age limit? Why have you kept it like that?
I think it's just a random number that we chose. I don't think there's any specific reason for the age 50. I think this applies though to all ages. So the final talk is going to be Rashida bin Cassubhai, who is a very experienced physical therapist who's been practicing for many, many years as a physical therapist and now has moved on as a guild-certified Feldenkrais expert who also will who's also practicing currently as a physical therapy outpatient practice with somatosensory techniques and Feldenkrais guidance, and she is going to tell us about nature's choreography.
Hi. Bismillahirrahmanirrahim. Assalamu alaikum. I'm humbled to be a part of this 2023 SBMAA medical conference. Fitness for over 50. Next one. Fitness for over 50 and above. Shazad said he was 25. I'm 49 and a half and not a day old. And so, I don't know what to say because I don't know how it feels to be 50. Having said that, fitness or age is just a number, as they say. It's all in the mindset. And we hope that as we get younger day by day, we approach it gracefully. Next slide. Having been a PT for many, many moons and a Feldenkrais practitioner for 17 years, my practice has evolved and has become more movement-based. So looking at a person as a whole versus individual muscles, joints, ligaments, a simple isolated movement, flexion of the hip, bending the hip, is as a result of some distal and or proximal body part which is helping you to achieve that knee flexion. So knee flexion is not just happening because the knee wants to flex. Something else is helping it to flex the knee. Every movement as such is therefore a nature's choreographed dance, and when the precision of that choreography begins to falter, dysfunction occurs. A person's fitness is in jeopardy. They are not able to do the daily activities. Things slow down, and oohs and ahs at every moment of movement, or even the thought of movement happens. So fitness over 50 is when a person can enjoy daily activities, recreational activities, walking, negotiating stairs, transitional movements needed when you sit on the floor, has the endurance to stand for matam, and most importantly, Akamal as Khushi, to be able to perform namaz in its full entirety. Next one, bye. Fitness from conservative point of view, as we all know, is muscle strength, balance, endurance, having normal range of motion, muscle strength 5 to 5, endurance, is all very important components of being fit. But once a person has all of these above, the choreography of putting it all together is what makes you fit in a possible, easy, and elegant way. Next one. Next one. As a practicing PT, my interaction with the unfit population which I have is my evaluation, which begins the moment I go to greet the patient. Nonchalant, I will just look at the way he or she is sitting, how he comes to standing, how he moves, walks, talks, or even looks. Looks, because that's the visual interaction he is having with his environment. Eyes play a big role in how we do what we do. And as most of you all know from the medical profession, that eyes are the gateway to the brain. Summarizing all of this above, it is, next one, the static and dynamic balance of your posture is what makes you fit. Efficient posture is how you carry yourself in space, within your environment, within your different activities. If you're bending down, how you carry yourself for whatever things in space is what makes you fit, where the effort is proportional to the action required. We in our society are so based on more is better, harder is better, faster is better, harder is better, or no pain, no gain. But it is vice versa, because you don't want to put so much effort where only a little effort is required, and you don't want to put so little effort where more effort is required. So that is where the effort is proportional to action to make you have a good static dynamic posture. Next one, please. To become aware of an appropriate posture, what do you have to do? Become aware of your skeleton. Muscles, joints, ligaments, all are good. Become aware of your skeleton within the baggage of the muscles around you. And this is the total paradigm shift that I have learned to respect, and that's how I approach my practice. The implicit sense of the skeleton and the forces that make you move the skeleton, helping to bypass any restriction that you may have from muscles and tissues, that is important. How do you bypass those restrictions? That is where when one of Sahabas have said, your inner knowledge of yourself, inner knowledge of where you are, what you are, how you are, what are you doing, why are you doing, is important. So it's not just going and pumping yourself up. It's like why I'm doing what I'm doing, how I'm doing it, and what is the purpose behind it. It's important to become sensorily aware of it. Because it's so easy to have compensatory movements which we will not even know that we have within ourselves. And these compensatory movements are hidden deep inside us. So until you can tap into that, you will not get to the root cause of what your issue is. Brain loves to find the homeostasis within itself. It understands language of movements. It does not know anything about your triceps or your biceps. It knows that you're bending your arm, you're sitting down. It doesn't know any other. So yeah, all that is like, it cares two hoots about your muscles. To minimize this compensation, how do you go around it? Do you do more? Or do you constrain yourself? Constrain yourself so that you stop doing what is not right before you learn to do what is right. Because if that old pattern is with you, it has embedded in your brain, you'll have to release that, erase that. जैसे अपने में कहते हैं ला बिफोर द नाम, निकाल दो ला, हर चीज निकाल दो तो नई चीज सीखेंगे हम. So to learn a new movement, you have to get rid of that old pattern. And that's where I think, I personally feel, कि मौला का एहसान है that I have done this Felt in Christ practice. मौला मोहम्मद बुरहानुद्दीन मौला का बहुत बहुत एहसान, उन्होंने मुझे रज़ा दी, and I took this because it's given me a extra tool within me to treat my patients. And मौला का एहसान again, alhamdulillah, I see just get good feedback from all of them. So as Moshe would say, the first quotation that you were looking at is from Moshe Feldenkrais, who was the founder of the Feldenkrais practice, which is somatosensory know-how, to know why you do what you do. And that is true for anything and everything. So Moshe would say, strip a person, and I'll paraphrase this, strip a person of all the muscles, leave him with a skeleton and an intact nervous system, and he will move. And he will move gracefully. So the skeletal awareness is the buzzword within me and within my population. How to become better than what you were before. To become better post-injury, post-surgery, mental, physical, emotional trauma, or even otherwise. And that is the crux of how to be fit. So, having said so much, I am fully born with verburitis syndrome. I came up with this. I don't know if it's there in the dictionary. We may have to, and I may have lost some of you. I would like to show, experiment, to get you all moving, with just a few minutes of some fun stuff to do. Harkat mein barakat hai, as I had it there, and Muhammad Burhanuddin Maulaka ne bhi aapne kaha hai, harkat mein barakat hai. So at this moment, ladies and gentlemen, just freeze. Freeze where you are. Don't change anything. And take a mental snapshot of yours, or a selfie, visual selfie, and put it in your pocket. So, I'm going to ask you all to look to your right. And then come back. and look to your left and come back. And do that one more time. Look to your right. Just make a note of where you go, how you are, and move to your left. Good. Now, hands on your thighs, please. You may need to move the chair a little bit. Hands on your thighs. Move your hands forward and back. One arm goes forward, the other hand goes back. One hand goes towards the knee, the other hand goes towards the groin. And this time, as you do this, move your head. So if the right hand is going towards the right knee and the left hand is going towards the left groin, turn to the left, look to the left. And repeat that to go the other way. And now when you do the same, make a note of what you saw when you turn. Do it again. As the left hand goes to the groin and the right hand goes to the right knee, turn and let your eyes go a little further from there. Let your eyes move a little further and see if your range just increased very subtly, but you just saw a little bit more. The neck movement, the range in your neck increased. And then come back. And now, go ahead and put your hands on your knees, around your knees or just by your knees, and let your right thigh become long. Push into the right hand. Right thigh ko right hand ki taraf push kare. Left thigh ko left hand ki taraf push kare. And do that a few times till you notice that something is happening in your pelvic girdle. Your pelvis is moving. And so, now let's put all this together. As your hands on your thighs, please. So look to your right, let your right hand move right, left hand move left, the hand that moves left, that's where you turn. Let your eyes go a little further and let your thighs move forward and back with this movement. So hands are moving, thighs are moving, head is moving, eyes is looking, important, look. And you feel you're just a little less than a bird. You're getting 180 degrees of movement to see your whole environment and the whole world has opened up to you. And now, Hayya al-Salat, Hayya al-Falah, Assalamu alaikum wa rahmatullahi mein, zara sa ye piche ke saf ko nahi dekna hai, lekin just look beyond, कि कहाँ तक नजर जा सकती है हमारे ये नमाज में. And I think किसी सबक में मैंने सुना है, and I don't want to go there, but there was a significant mention about the nazar during Hayya al-Salat, Assalamu alaikum wa rahmatullahi. So this was the Feldy way of doing it, right? Slowly, ye karo, wo karo. So now let's get out of the Feldy mode. And आप लोग बैठे हैं जहाँ पे, lift your right leg up and down, up and down. So up and down, interestingly, everybody will have a different concept of what is up. I see some people and they're doing good. Up is up, right? Up is not forward. And the leg is the leg. And it's not the lower leg, it's a leg, right? So lift your right leg up and down a few times, get a sense of the movement, and that's the sensory part where we have to become a little bit more tuned. हम क्यों कर रहे हैं, कैसे कर रहे हैं, how, why, what, when. अब left पाँव को उठाइए, and you may notice that एक पाँव जरा ज़्यादा भारी था, ज़्यादा जा रहा था. भाई, we are not kicking the leg, we are lifting to the ceiling. Yes, I'm sorry, I'm mentioning you because I just see from there where you are, what you're doing. So, ऊपर उठाना है हमने, ऊपर उठाना है, right? हाँ, अब ये उठा लिया, अब भूल जाएं 2 सेकंड के लिए. अब जो है, right heel को उठाइए ऊपर नीचे, सिर्फ heel. Now there's a big issue between a heel and the toes. Heel बोलो तो पंजा उठता है, पंजा बोलो तो heel उठता है. तो know yourself, क्या है heel? What is the heel? So lift your heel up and down a few times. उठाया, अब लेफ्ट हील उठाइए कुछ मर्तबा, yeah. So heel up, one heel up, the other heel up. You're sending some message by this. You're sending a message to the noggin up there. So अब जब आप पैर उठाएंगे, so lift your leg up and see what happens. Do you feel it just lifted a little higher? Yeah. Did you feel it became lighter? Did your hip flexors all of a sudden become strong? Did you bypass the joint issue out there? No. It was the calf muscles helping you to initiate the hip flexor to lift your leg up and down. And in such a nice, fun way, right? Yeah. It was, उठा रहे हैं, थाकी गई, लकी था तू, right? अब heel उठा के उठाइए, वाह. Up and down and up and down and off you go. Very important when you're going up and down the stairs. Believe me, अभी अगर आपको सीढ़ियाँ चढ़ने और उतरने में तकलीफ होती हो तो कोशिश करिएगा कि एड़ी उठा के फिर मैं पैर उठाऊं. ऊपर जा रहे हैं, नीचे आ रहे हैं. So if you have restrictions in your ankle, it's not your hip or your knee. We need to work on that ankle.
Out of everyone that's spoken so far, this is the most important point of this whole presentation. So everyone needs to understand the physiology of their own body, what their limitations are, what they can and can't do. A simple calf raise like this may be very difficult because you're in a corner until you see it. So you have to, again, when you look in the mirror, when you do self-reflection about what fit means to you, you have to analyze what you can and can't do and come up with a plan.
So now we've learned how to lift. So right पाँव को उठा के we'll come down on a toe box. उठा के we just come down on a toe box. So एड़ी ऊपर रहती है. So we are just coming down, hitting the toe box, which according to the Chinese people and all is where the balance, according to anatomy, is where the balance center is. Chinese people कहते हैं वहाँ kidney point है. So काफी acupressure points भी हैं वहाँ पे. So you're just lifting and hitting your toe box where the toes meet the metatarsals. Now we are going to lift both our heels up and alternate उठाएंगे. So हम उठा रहे हैं ऊपर नीचे, right alternate, right left, right left, right left, and there you go, marching by and go, 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 and jog, 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 and up and down and up and down and pause and rest. Right? Take a breath. And now, you're going to lift both your heels up. You there with me, my friend? Lift both your heels up. Make sure if you need to hold the chair, please hold the chair. And दोनों heel उठा के lift both your legs up and down. Up and down. पंजे नीचे. पैरों की उंगलियां नीचे. Both up. Up and down. Up and down. Up and down. Up and down. Horsey, horsey, giddy up, giddy up, giddy up, giddy up. Horsey, 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 horsey. Yes. And pause and rest. So you did some jogging, right? Good. Have to stop. Oh, quick one. Yes. And concluding, absolutely concluding. Just do some breathing, breathe out. Breathe out is more important than breathing in. सांस है जब तक जिंदगी सांस लेता आया ही जाएगा. सांस निकालना भूल जाएंगे तो मुश्किल हो जाएगी. So breathe out. And breathe out with a squeeze. हमने सांस यहाँ नहीं लेना है. घबराहट हो रही है. नहीं. So we breathe in and out through the rib cage. Get that breathing going. And now, the last one, which is my favorite one. Take a break. Loud and big. As we get older, the loud and big concept should be our mantra. आहिस्ता आहिस्ता बात करना, मुंह नहीं खोलना, छोटा छोटा बोलना, छोटा छोटा चलना is not the way to go if you want to be fit. Big steps, big movements. Open your mouth to talk so the other person doesn't have to strain to listen to you. And so, move your tongue over your teeth, front of your teeth, and you will find your jaw move ho raha hai. And so you're getting some work there. Ab go behind the teeth and move your tongue. And notice skipping all movement ho rahi hai. Zara deep in, which is so important because wahan tongue jama hai. So wo movement ho rahi hai. And now, I hope I've got it all. I do. From my Tai Chi exercise, this is where I end my session with make a light fist, air in the fist, bring it to your thymus gland here, and go one big, two small, one big, two small, one big, two small, one big, two small, one big, two small. And why do we do this? Thymus is your immunity center, so you're facilitating your immunity center. तो ये हम मातम के तौर पे कहते हैं, तो हमारी इम्यूनिटी बढ़ती है जब हम मातम करते हैं, क्योंकि हम उसी सेंटर को हम मारते हैं. And then, my last one, sit nice and well comfortably. We've done, opened the mouth, सांस ले लिया, सब कुछ कर लिया है. So the vowels. Please go to the next one. The skeletal awareness, we talked all about it. It's not there. So the vowels are A, E, I, O, U. You know how to open your mouth big? Join with me and begin. Sans bhi le liya. A, Shukran, thank you for your attention. I appreciate it.
Shukran. Sagla speakers ne excellent talks. Rashida Ben, that was the perfect way to finish. And shukran to everybody. Sagla no shukr guzar che you for listening to us and inshallah apne sagla ne fayda utha se. Shukran. Janab Ibrahim Basi.